On the first day that we had the new aircraft, the EC-145, at Cambridge for its very first shift with us, was quite a momentous day, and it really was a day that we'd been planning for so many years. It came as a bit of a shock though, because just a few minutes into the shift, early on, we'd pulled the aircraft out of the hangar, made sure that all the right equipment was on board, that we'd been through all of the checklists, and the phone rang, the emergency phone, to say that there was an incident way down in the south of the patch, and a patient that really needed our care. And it was an amazing and interesting job, because it was the first time that we were working with two pilots and the crew together. So there were 5 of us on board, and yet the aircraft performed flawlessly. I mean, it was amazing. The patient needed to be flown in the back of the aircraft on the new stretcher, which was really its first time out, and the first time that the stretcher had been required. And it just made life so much easier throughout the flight. Rather than in the normal aircraft, we can only get to the top half of the patient. Actually, there was full access, so we could continue work en route to the hospital as well, which just made such an enormous difference. Quite convinced that the ability to be able to do that will make a dramatic difference to a lot of patients. The patient that we had as first off really was a fantastic example of the sort of patient that would benefit from the equipment that we now have on board. A patient who is a fall from height with multiple injuries, and really needed airway protection and lungs to be ventilated at scene. So very high levels of medical intervention needs to be put onto a ventilator, and really using that on board the new aircraft with the new stretcher meant that we were able to do so much more for the patient in a much safer and more reliable way than we've ever been able to do before.